In this video, we delve into the multifaceted realm of depression, a mental health condition that touches the lives of millions. From understanding its symptoms, causes, and diagnosis to exploring its profound effects and the importance of addressing it, we embark on a journey to shed light on this often misunderstood condition. By enhancing our knowledge and fostering empathy, we can better support those facing depression and work collectively to build a more compassionate and informed society. Introduction. Definition of depression. Depression is a mental health disorder characterized by persistent and profound feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It goes beyond the normal fluctuations in mood that people experience in response to life's ups and downs. Depression can significantly impact a person's thoughts, emotions, and physical well-being, often leading to a range of debilitating symptoms, such as persistent sadness and a low mood, loss of interest or pleasure in previously enjoyed activities, fatigue and low energy levels, changes in appetite or weight, sleep disturbances, difficulty concentrating, making decisions, or thinking clearly, feelings of worthlessness or excessive guilt, recurrent thoughts of death or suicide. Depression can vary in its severity, with some individuals experiencing mild symptoms that do not significantly disrupt their daily lives, while others may have more severe forms that interfere with their ability to work, study, maintain relationships, and carry out everyday tasks. It is a common mental health condition that affects people of all ages and backgrounds and can be caused by a combination of biological, psychological, and environmental factors. Treatment for depression often involves a combination of psychotherapy, medication, lifestyle changes, and social support to help individuals manage their symptoms and improve their quality of life. Differentiating between sadness and depression. Sadness. Duration. Sadness is usually a temporary emotional state triggered by specific events or circumstances. It tends to fade naturally as time passes and as the individual processes their feelings. Cause. Sadness typically arises in response to identifiable events such as a loss, disappointment, or a difficult life event. It is a normal reaction to life's ups and downs. Intensity. Sadness can range in intensity from mild to moderate and may not significantly impair daily functioning. It often accompanies grief or disappointment. Physical symptoms. Physical symptoms of sadness, such as crying, may be present but are usually in proportion to the cause of the sadness. Duration of symptoms. Symptoms of sadness are tied to the triggering event and tend to improve as the individual processes their emotions and adjusts to the situation. Depression. Duration. Depression is a prolonged and persistent state of low mood that lasts for weeks, months, or even years. It does not naturally lift with time or change in circumstances. Cause. Depression may not have a specific external cause, and it can arise without a clear trigger. While it can be triggered or exacerbated by life events, it often persists even when life circumstances improve. Intensity. Depression is characterized by intense and pervasive feelings of sadness, hopelessness, and a lack of interest or pleasure in most activities. It significantly impairs daily functioning and can affect one's ability to work, socialize, and enjoy life. Physical symptoms. Physical symptoms of depression can include changes in sleep patterns, changes in appetite or weight, fatigue, and physical aches or pains. Duration of symptoms. Depressive symptoms persist over an extended period and are not solely tied to external events. They may recur, and individuals with depression often experience multiple episodes throughout their lives. Suicidal thoughts. Depression can lead to recurring thoughts of death or suicide, which are not typically associated with ordinary sadness. Types of depression. Major depressive disorder. Major depressive disorder, commonly known as depression, is a debilitating mental health condition characterized by persistent and profound feelings of sadness, hopelessness, and a loss of interest or pleasure in daily activities. Lasting for at least 2 weeks, major depressive disorder often disrupts sleep patterns, appetite, and concentration, leading to exhaustion and a sense of worthlessness. It can erode one's ability to function effectively at work, school, and in relationships. Biological factors, including imbalances in neurotransmitters, and psychological factors, such as negative thought patterns, contribute to its development. Fortunately, major depressive disorder is treatable, with approaches ranging from psychotherapy like cognitive behavioral therapy to antidepressant medications. Timely intervention and ongoing management are essential for recovery and preventing recurrence, empowering individuals to regain their quality of life and overall well-being. Persistent depressive disorder. Persistent depressive disorder, also known as dysthymia, is a chronic and often overlooked form of depression that casts a shadow over an individual's life for an extended period. Unlike the episodic nature of major depressive disorder, persistent depressive disorder entails a persistent low mood, feelings of hopelessness, and a pervasive lack of interest in daily activities that last for at least 2 years in adults and 1 year in adolescents and children. These enduring symptoms can erode self-esteem, disrupt sleep and appetite, and impair concentration, making it challenging to maintain social relationships and occupational or academic functioning. While the exact causes remain complex, a combination of genetic, biological, and environmental factors likely contributes to its development. Fortunately, persistent depressive disorder is treatable, often through psychotherapy like cognitive behavioral therapy and, in some cases, antidepressant medications. Early diagnosis and consistent management are essential for helping individuals break free from the persistent grip of persistent depressive disorder, restoring their sense of well-being and reclaiming a brighter future. Bipolar disorder. Depression in bipolar disorder represents one facet of this complex mood disorder, characterized by alternating episodes of depression and mania or hypomania. During depressive episodes in bipolar disorder, individuals experience the same debilitating symptoms as those with major depressive disorder. These include deep sadness, hopelessness, sleep disturbances, changes in appetite, fatigue, and thoughts of worthlessness or suicide. However, the key distinction lies in the cyclical nature of bipolar disorder, with individuals also experiencing manic or hypomanic episodes where mood elevates to an elevated, often overly optimistic state. The presence of both depressive and manic episodes makes the management of bipolar depression particularly challenging. Treatment typically involves mood stabilizers, psychotherapy, and sometimes antidepressant medications, carefully monitored to prevent triggering manic episodes. Effective management of depression within bipolar disorder is essential to stabilize mood fluctuations and improve overall quality of life, aiming for a balance between depressive and manic states to achieve emotional stability. Seasonal affective disorder. Seasonal affective disorder is a specific subtype of depression that follows a seasonal pattern, typically occurring during the fall and winter months when daylight hours are shorter. This condition is characterized by recurrent episodes of depression that coincide with the changing seasons. Seasonal affective disorder's symptoms are similar to those of major depressive disorder and include persistent low mood, loss of interest in activities, increased sleep, overeating, weight gain, fatigue, and difficulty concentrating. While the exact cause of seasonal affective disorder is not fully understood, it is believed to be linked to reduced exposure to natural sunlight, which can disrupt circadian rhythms and affect neurotransmitter levels in the brain. Light therapy, where individuals are exposed to artificial light sources that mimic natural sunlight, is a common treatment for seasonal affective disorder. Additionally, psychotherapy and, in some cases, medication may be recommended to help individuals manage their symptoms and regain their usual level of functioning. Seasonal affective disorder is a condition that can significantly impact one's quality of life during certain seasons. But with proper treatment and coping strategies, many individuals can effectively manage their symptoms and enjoy a better overall well-being. Postpartum depression. Postpartum depression is a distinct form of clinical depression that affects some women after childbirth. It typically occurs within the first few weeks or months following delivery, although it can sometimes develop later during the first year postpartum. Postpartum depression is characterized by a range of emotional, physical, and behavioral symptoms, including profound sadness, feelings of hopelessness, irritability, sleep disturbances, changes in appetite, fatigue, and difficulty bonding with the newborn. It is essential to differentiate postpartum depression from the baby blues, which involve milder and more transient mood swings that commonly occur in the days after childbirth. The exact cause of postpartum depression is not fully understood, but it is likely a combination of hormonal changes, genetic predisposition, and psychosocial factors. The experience of postpartum depression can be isolating and distressing for new mothers, impacting their ability to care for themselves and their infants. Timely intervention is crucial, and treatments for postpartum depression may include psychotherapy, antidepressant medications, support groups, and lifestyle adjustments. Identifying and addressing postpartum depression is essential for the well-being of both the mother and the baby, as untreated postpartum depression can have lasting effects on maternal mental health and child development. With appropriate support and treatment, many women with postpartum depression can recover and develop a strong maternal bond with their baby, allowing them to navigate the challenges of motherhood more effectively.